Guys, once again, Ijaz Hidayat is with you with new topic. Today's the topic is ultrafiltrations during cardiopulmonary bypass. Why we need to do the ultrafiltration during the cardiopulmonary bypass, especially in a pediatric surgery. Ultrafiltration is the process which we are using during the pediatric, mostly in the cardiac surgery, and it is there is two type of ultrafiltration. One is conventional ultrafiltration, and the other one is modified ultrafiltration. So first we need to know what is ultrafiltration. So ultrafiltration is normally the process of the filtering of the water across the perimebial membrane using the energy derived from the hydrostatic pressure gradient. When the water crosses the membrane, it creates a solute concentrations gradient between the blood and the ultrafiltration side of the membrane. It's mean from higher concentration to the lower concentrations. What is happening in the ultrafiltration? Normally, the blood pass through the hemoconcentrator. A hemoconcentrator is device which made up of the holy fibers membrane, and the size of the pore size of the membrane is about 5 to 10 microns. And when pass through the filter, which is called the hemoconcentrator, and it create pressure there, the inlet pressure and the outlet pressures. There's two pressures. The blood which is entering into the hemoconcentrator is the P internal pressure, and the blood which is passing out from the hemoconcentrator is P out pressure. So the TMP, the difference pressure, transmembrane pressure, it should not go more than 5 to 600 millimeter per mercury, because if your pressure TMP is higher than 600 millimeter mercury, there is a chance of rupturing of the membranes. So of course the hemoconcentrator, TMP, and of course hematocrits. So this is the, can you show this diagram to my viewers? So this is actually the diagram of ultrafiltration. Normally blood entering into the hemoconcentrator, this path, and it will go through the membrane, and this is the outer layer. So there is a two chambers here. Is a higher concentration to the lower concentration. So in the transmembrane pressure, when we create like a 400 to 500 pressures, the ultrafiltration with the rate of the ultrafiltration be higher. So the low solutes and the plasma water will come out from higher concentration to the lower concentration, and this is the mechanism during the process of ultrafiltration. So as I mentioned, it depends on the pore size, membrane materials, membrane thickness, and ultrafiltration coefficient CUF. So the rate of the ultrafiltration normally is 2 to 50 mils per hour per millimeter per mercury. Of course, by increasing your TMP, there is you will going to increase the rate of the materials depend. So ultrafiltration removes the plasma water. Actually, during the ultrafiltration, we remove the plasma water, which help us to increase the viscosity of the blood, which decrease the dilutions, and we can maintain the blood hemoglobin during the bypass. And of course, the most common factor of ultrafiltration is it remove the inflammatory markers also. So it is one of the benefits of the ultrafiltration is that we remove the inflammatory markers during the ultrafiltrations, which is going to help to heal the blood efficiency during the bypass. So this is the hemoconcentrator. Normally we entering the blood, passing out the blood, and then we filter, we suck out the plasma water during the process of hemofiltrations. Now question is, when we are going to use the term CUF and MUF. CUF is conventional ultrafiltration and MUF is modified ultrafiltration. CUF is processed during the bypass surgery, especially in the pediatric surgery. We design a circuit that we connected the inlet part of the hemoconcentrator with the arterial line, in our arterial line, and which take oxygenated blood from arterial side into the hemoconcentrator. By processing and passing through the hemoconcentrator, blood return back into the reservoir, and this is with the help of the arterial pump. We generate a pressure during the when the pump is running, and we process ultrafiltration, and we remove plasma water during bypass. So this is happen conventional ultrafiltration is during the bypass, but modified ultrafiltration is immediate after bypass, when the patient's cannula is still inside the patient, but we enough from the bypass. So the circuit design for the modified ultrafiltration is we take oxygenated blood from the arterial cannula, from arterial side, and the blood pass through the hemoconcentrator, and with the low rate, after process passing through the hemoconcentrator, we return back the blood into the atrium, right atrium, with the venous cannula. So the rate of the modified ultrafiltration is like 30 to 50 mils per minute, and the time of the modified ultrafiltration, we run your main arterial pump. For example, your main arterial pump, the flow of the main arterial pump is like for the 50 mils per minute. Then we set the MUF, modified ultrafiltration pump, like a 60 to 70 mils. So depends. So your modified ultrafiltration pump should be, the rate of the modified ultrafiltration rate is higher than your main pump. Otherwise, if you keep the main pump or main arterial pump in higher side during the modified ultrafiltration, there is no use of the modified ultrafiltration. So always keep the lower side of your main arterial pump and the higher side on your modified ultrafiltration during the muffing of the pump during the vein of from the bypass. So once again, the type of ultrafiltration, as I mentioned, this is a conventional ultrafiltration occur during bypass to maintain the hematocrit. As I mentioned, by doing the ultrafiltration during the bypass mean conventional ultrafiltration, which increase your viscosity, increase your hemoglobin removing of the water, and which maintaining your hematocrit during the bypass. But in the modified ultrafiltrations, we occur after the bypass to remove the excessive fluid and maintain the hematocrit. So zero balance ultrafiltrations occur during the bypass to maintain the electrolytes, but in this ultrafiltration we added extra fluid and then filtrate the fluid taken out, the one which we have given. So we'll explain as much I know, and hope it will going to help you for during your time of ultrafiltration. Have a nice and good day. Take care. Bye bye.